Go.
Hello and welcome to the special talk to the Senator Bin Gopal of New Jersey, District 11, a very young and promising and talented politician. And of course, delighted to welcome two other guests today, Anand Shah, Councilman, Borough of Prospect Park, a businessman, and Hitesh Bhatt, President and CTO, Bhatt Foundation. Before I begin, let me introduce Senator Vin. Vin Gopal is a lifelong resident of Monmouth County, born at Jersey Shore Medical Center in Etude. He is a small business owner, having built his business from the ground up, now with 14 employees. Vin is also the organization dedicated to helping Monmouth County charities and individuals. Indeed, he holds a master's in public administration from Rutgers University. Vin previously served on the board of directors of the then Monmouth County Chamber of Commerce and also served as president of the Hassan Township Business Owners Association. He is, of course, also the past board of trustees members of Big Brothers Big Sisters of Monmouth County. Vin spent many years as a volunteer, first responder, serving as an EMT and certified CRR instructor. For the audience better understanding, I'd love to add some more points about Senator Vin. Vin serves as a Senate Majority Conference leader and chairman of the Military and Veterans Affairs Committee. He also serves as vice chair of the Senate Higher Education Committee and as a member of the Health, Human Service, and Senior Citizens Committee. Welcome to the show, sir, Vin Gopal.
Thank you so much for having me.
All right, and I, of course, welcome two other guests. It is Bhatt and Anand Shah. Welcome to the show.
Thank you for having us.
All right. And of course, we have Farazin of Channel 52
Hello.
there.
Hello, everyone.
Before I begin, let me give you a small recap of the COVID-19 situation. The coronavirus information is showing us right now. The infection, it is 4.5 million plus right now. And death, it is 0.3 million. It's a huge right now. So the world is now going across, crossing a catastrophic situation and trying to come to the life in a normal situation to get back to normalcy. And you were thinking about reopening the small businesses because life must go on. If I begin with Senator Vin Gopal, what's your thought about the reopening of small businesses in New Jersey, sir?
So we're watching the curve continue to flatten. New Jersey, we approximately have a little over 10,000 people who've died. I strongly believe, according to every health report, that if we didn't do the social distancing that we did across the state, that I know that Councilman Anand Shah did up in North Jersey and what we did here in Central Jersey, we would have had much more than 10,000 deaths. But that said, we're taking steps to now open the economy in a responsible way. We started with opening the parks as well as the beaches next week, curbside retail for businesses. And it's going to be like a faucet, just turning it a little bit and making sure that those death tolls don't spike. And so we're going to try to do it in a slow and responsible way. New Jersey, as you know, has one of the largest South Asian populations. Bangladeshi Americans, Indian Americans, Pakistani Americans here in New Jersey. We're one of the most diverse states. And between New Jersey and New York, that is where the strong majority of the COVID-19 cases are in the United States. So as government leaders, we're doing everything we can to try to make sure we open responsibly and at the same time make sure that our economy doesn't collapse.
All right. All right, the situation we are going through is really catastrophic as, two other guests are also coming across this situation. I'd like to go to Hitesh Bhatt, who is the President and CTO of Bhatt Incorporation, Bhatt Foundation. But what's your view regarding the reopening of business?
So first of all, thank you for, I think our Senator Vin
said very well. I want to give kudos to our Senate, Congress, and Assembly and Governor. Governor did a wonderful job. I've been watching every day, and gradually, I agree with Senator opening with the faucet, similar to what I was experiencing in Australia just a couple of weeks ago, and it contained the curve. It just bring it down to the really manageable level, and now we are at the level that everyone's understood the basic hygiene and social distancing and having impact on our personal life. So this will be a totally new phenomenon for all of us. As a foundation, I run Global Foundation, and then I was supposed to be in Ethiopia today, and I couldn't go. And that impacts all our innovation technology. We're working on it. It's on a hold right now, and that's affecting a lot of people as well.
All right. If I now go to Anand Shah, Anand is a councilman for Prospect Park. You are very much, having your time with the people on street, the common people in business. So what's your personal view about reopening the business plan? What do you think really?
That's a great question, Doctor. First and foremost, I want to, everyone that has tuned in, I want to say salam alaikum to all the elders, the brothers and sisters, and ladies and gentlemen. I know it's Ramadan time, so happy Ramadan thus far. I also want to say Ramadan Kareem, Ramadan Mubarak. I know some of you have just broken your fast a little while ago, so thank you for tuning in. And it's great to be here, obviously. And just like our honorable senators say, I totally agree with them. Just opening it, and like Hitesh Bey as well, opening it with a small faucet, it's totally a great example, right? I mean, with the beaches opening, with the shores opening, even down in Monmouth County, correct? But with the social distancing, I think is the key. And my biggest word, one word I have for each and every one will be, it's hope. We should always have hope, right? No fear, but has to be hope. I mean, we already seen in the past what has happened thus far. How many cases has been there? How many deaths have been there up to now thus far? What is the future going to be like? Now, we have seen it as something that we cannot change, but we could definitely move on and change the future. As our daily governor gives us the updates every day and afternoon, as our honorable senator gives us the updates, that's what's going on and what they're fighting for us in Trenton. So I think we're taking every precaution, every caution that's out there, because this is, I think, a pandemic that we have not experienced. And me, even as a business owner, I have Subway restaurants, and even with the social distancing guidelines, and thank God people are still coming in here and there. But a lot of people, what they have also been doing, a lot of my customers even have been doing Uber Eats delivery, for example. Our Uber Eats have gone up 30%. Grubhub delivery has gone up 35%. DoorDash has gone up 30-40%. Postmates. So people are definitely taking advantage of it. And I think by adhering the guidelines from the governor, I think that will help us move forward throughout the state and throughout the country.
All right, Senator Vin, in June so far, we have learned about this forecast that USA will touch the death toll for COVID-19. It will be 100,000. And of course, it's a big death toll in the world right now. It's the highest death toll ever in America so far. So what's your view about this catastrophic disaster while President Donald Trump is thinking to lift lockdown in many states?
Yeah, it looks like many states are in a little better shape than New Jersey and New York. We look at India starting to get worse, other places of Asia starting to spike again, in Europe. But we have to do it responsibly, and we have to monitor it, and it has to go week by week. Roughly half of our deaths here in New Jersey are at senior assisted living facilities. So that's been a big problem across the country, is these senior facilities, as soon as the virus hits one, it unfortunately, kills all of these folks that are in their 80s and 90s, and it's really terrible. Testing needs to increase. We just allowed in New Jersey pharmacies to test, so we expect a couple thousand new pharmacy locations, Walgreens, Rite Aid, independent pharmacies, CVS to all start testing soon. And as we expand testing, we have to do better here in the United States. I mean, we were just a month ago as New Jersey and America basically begging for gloves and masks and hand sanitizer, and constantly having to go to China. This is a real lesson for the United States that we need to invest in manufacturing and technology here, even if it costs a little bit more money. We have to be able to get these gowns and these masks, KN95 masks. We have to be able to produce them here in the United States because what happened when we were literally begging for it a month ago is not going to be good. And by all health indications, there's a good chance that there can be another wave coming up in September, October, and it's important that the United States is prepared for that.
All right. I'd like to add one more point. Is by August, 4, the death toll will cross or nearly 150,000 so far, according to the CDC precautions or the forecast protocol. And if we consider the death toll, the casualties we see, first of all, New York, then your state, New Jersey, then Massachusetts, then in Michigan. How worried you are being the second in line next to New York?
Very concerned, and that's why we have to do this slowly. Unfortunately, there are people out there. Look, we believe that 95% of people are handling this very responsibly, and that's why we've seen the incredible amount of social distancing, 6 feet, masks in the last 60 days. But that 5-10% is just a very loud 10%. Those that are saying they want to open everything up tomorrow is just not responsible. You have to do this slowly and responsibly and make sure that the deadliness of this virus doesn't spread. We saw this throughout history, 1918 and other points of history where this virus, similar types of viruses have come up. And it's important that we study it, figure out how to get vaccinations and figure out how the science behind it. And there's so little we know about it still to this day. And it's important that time is the only thing that's going to heal that. And that's why it's important we do it responsibly.
All right. Hitesh, you work for the foundation. The foundation really works for education and health. At this point of time, while we are going to the coronavirus situation globally, what your foundation is contributing towards people's life in New Jersey and, of course, across the globe.
Right. So I agree with Senator. I think I totally, and this is what we are focusing on a foundation. You can see this. We just announced with the human scale we've been working on for the last couple of years. This is an antimicrobial keyboard and a mouse built into it. So it kills MRSA, SARS, Ebola, all the viruses, and upon touching. And it lasts about 70 years. This cycles on the medical device keyboard. And it's machine washable, and those are the one I'm focusing on it. And then we design it with the cellular network with the cases that also with the healthcare essential employees or essential service providers in ER, OTC, everywhere they can use this, and it kills the bacteria and viruses. Of course, then the device like the N65, which is a Zebra that we participated and we're testing it. So you got all the Epic, EMR, EHR, everything is on a real-time data. So this way the virus doesn't spread. And those are the things we're working on. And I've been testing. I just received this morning N95 from China to just compare with our EM mask. And I totally agree with senators and governors that we need to bring manufacturing all the devices, back in America here in made in USA, and has to have some sort of like a standardized equipment. So this way the quality does not compromise on a PPE side, and those are the things the foundations involve, multi locations. We're trying to figure it out, similar to Zika kit we created a long time ago. Now we're trying to figure out how can we do Ebola and as well as COVID, the kits the consumer can have and have educations and have a sanitizer. So I'm actually designing. I just got a couple of samples, which is it's almost like a 60-70% alcohol in it. We haven't tested yet, but we're working on it. So as soon as we figure this out, which kit goes where, and then we're going to design something like this, and then we want to give it to each country the foundation currently presents, and we want to make sure that they participates in this amazing type of Ebola kit we created back then, similar to the knowledge, their samples, and how they can, to maximize ROI on our investment and knowledge. And that's what we're working on it right now.
All right, you partner for healthcare and education as you consult with partner brands in helping implement healthcare and education around the globe. You work with Toshiba, Panasonic, Samsung, Zebra, and so many globally renowned brands. What they're doing for the betterment of the global people during this disaster? Because as a part of corporate social responsibility, these big companies and brands should come ahead because this is not only the responsibility of the government alone, but for the people, for the corporate ventures, and people from all across of life, including the biggest corporate brands as well.
Yeah. So as far as like look at what's happening. Google and Apple announced with the app space. I was just about 4 weeks ago. I was in Australia, and they were tracking everyone in Australia through the apps. India has one of the best apps. Like as soon as you land, it's mandatory by custom that you must download apps and register to your SIM card so they can track you where you're going, how far, and social distancing, who you're meeting. And this is similar to I know we're going to have to give up some of our personal privacy, but I think so be it. But look at the safeties and look at the ROI and look at how the social phenomena we can get the maximum ROI on this. As far as all the manufacturing goes, everyone's working on it to help to get the maximize, to telehealth side. We're focusing on this little tiny device. I cannot believe this. Everything you wanted to do in a hospital, you can do it in a remote location. Now, 5G is available. Rush University, first in the United States to launch 5G robotic surgery. Now 5G is finally accepted, and you can even manage to the robotic surgery on this device. So those are the things each manufacturer is working on, and Google's using on their clouds. Apple has its own devices. Microsoft has amazing the cloud-based applications, and each manufacturers are participating to helping NBOT Foundation and vice versa. So once we figure out what's the best way, what's the slimmest way to get the maximum ROI on a manufacturing side, on a physician side, even on education side. I have two daughters, and they are right now they're studying from home. And their virtualization to learn how can we to do on the lab on the virtualization, because we never experienced anything like this before. So this is something new for all of us, and I think we are really we're getting there. That's using technology and maximizing ROI as far as all this manufacture goes.
All right, I'll again get back to Senator, but before I go to him with a new question, I love to touch Anand. That's of course it's a question of life and livelihood. And the lockdown cannot continue too long because people need to survive. They need to eat, right? They need to survive. So now the question is how the people are taking this long-term lockdown in New Jersey. As I said, you mix with the people on street, you mix with the people in the shops, and you definitely mix with the people in the domestic, right?
That's right. So just to understand and clarify your question, the long-term lockdown, right? Is that right, doctor? Your question?
Yeah, it's a long question of lockdown, and the question is of life and livelihood. How long it will continue? Because if lockdown continues, the economy definitely be jeopardized. So it should not be prolonged for the sake of the economy, for the sake of livelihood. That's the question. So how the people are taking in New Jersey?
And that's a great question, doctor. And just like our senator and Hitesh Bey have put points on it, I think we're moving in the right direction, something that we have not experienced. Compared to about in March to now, I think the lockdown has got a little bit better. The reason why, again, is what's happening Memorial Day weekend that the governor has announced and happening in our Senator Vin Gopal's county, in Monmouth County. What's happening? The beaches are opening. The shores are opening. People are allowed to go out as long as you follow the social distancing guideline. Again, the social distancing guideline with the 6 feet away. The governor is allowing us to come back out, enjoy the weather, enjoy the beautiful weather that we're having. So I think we're getting to a point, like the senator initially said again, is opening the faucet slowly, not all the way, but slowly, right? Another way, what else is happening? Apart from that is that the testing is still going on. that we have to take the precautions. Now we have residents that are going to get tested and doesn't need a prescription. Before you need a prescription, there's a cost involved to go visit a doctor. Now we don't need that in some of the areas. You don't need any symptoms. So you could get tested, even though if you don't have a flu, a fever, a coughing, sneezing, you can still get tested for the COVID-19, which is another great news. They're also working on the vaccine. And not to be biased, but I also heard that India is also working on with United States to actually come up with a vaccine. But whoever comes up with it first, slowly but surely, if the vaccine comes in for this COVID-19, that will also help us with the quarantine and making the lockdown easier. If the vaccine does come in and passes through all the tests, I think that people will be allowed to be out often again, right? And then we can move on with our daily lives. So that's where I stand with it. And I think slowly but shortly, using the mask, using the glove, using the social distancing guidelines, those three things, people are still able to enjoy outside. Maybe not at the full capacity before March like we were, but we are definitely moving in the right direction slowly but shortly.
All right. As I said that I'll get back to Senator Veen. The question is very big question right now. 33 million people are jobless right now in America, which is 20% of total American workforce. It is really very harder. What do you think, Senator Veen?
Yeah, I mean, look, it's where we have to responsibly reopen the economy, and I think that the state and the country as a whole are taking those steps. All millions of people on unemployment at no fault of their own. Millions of business owners not allowed to open at no fault of their own. Government has a moral responsibility here to make sure that every one of these individuals are taken care of, because they're basically not allowed to earn a living, and it's not their fault. We have in this country, unfortunately, New Jersey, going back many decades, a very antiquated unemployment system. And that's something that after this tragedy happened, just after we talked about, we need to make sure that we have manufacturing here in New Jersey, New York, as it relates to hand sanitizer and gloves and N95 masks. The same thing has to happen with a revamping after we get by this pandemic on fixing our unemployment system, making sure the technology is not 20 years old, making sure it's easier for people to get in, because God forbid if this happens again, and statistically there's a chance, right? This is the first wave. So there's going to be a lot of Monday morning quarterbacking related to all these things, how we deal with our assisted nursing homes or living facilities, all these areas. But important to make sure that we get, New Jersey just hired another 130 people that they moved from another department to their unemployment office. We just have to process as many of these unemployment claims as possible. For those who are watching that may still be having trouble getting unemployment, please reach out to your legislator's office, as well as Department of Labor, but know that even if you're not getting through, you are entitled to every penny that you should be getting. So even if you haven't gotten anything in 3 or 4 weeks, you will get that full amount.
All right, so we got some questions from the audiences right now who are on screen and watching a discussion. Riyad Matari, thanks for the info, very helpful. Anand Shah, you are the man, Paul. Okay.
Thank you, Riyad.
Now the Askan Ilamasli, Anand Shah, thank you for all information. Ambar Haq says, what about business opening yesterday? How can that impact on the guidelines if Senator Veen answers to the questions of Ambar Haq?
I'm sorry, the question is how.
She wants to know what about the business opening yesterday? How can that impact on the guidelines?
So New Jersey.
We definitely see the questions on screen. Yeah.
Sure. So every day, as we talked about that faucet, New Jersey is opening a little bit every day. Just in this past week, they've opened curbside retail for non-essential businesses, meaning they could sell curbside. They've opened construction. Today, they opened all fishing and boating, charter boats. I believe Monday is going to be elective surgery if it hasn't happened already. And so I think you're going to see piece by piece. Number one statistic that's important is the hospitalization rate as we're going along. More people right now for the past almost 2 weeks, have been leaving the hospital than coming in. We still have a lot of people coming into the hospital, but that's the number that's important, is our overall hospital capacity. So I think you're going to see the governor continue to open more things. over different elements of businesses. I know restaurants can now have a lot more options as they do delivery and curbside. I think eventually you'll see at some point restaurants open with outdoor dining. I don't know when that will be, but that will happen at some point with some kind of capacity. As all these things are happening, I know the Department of Health will be monitoring the hospitalization rates to make sure that more people are not coming in than going out.
All right, one more question we got from Ashgan Elamoli. He says, how do the loud people going to the shore and opening the store when the virus spreading so fast and people are dying?
I'll let the senator.
Thanks. I look, I want to.
Everyone should pause the question. Okay, Senator.
No, it's okay. I would tell you that.
Yeah.
I would tell you, look, we know that outdoors the virus is not as bad. So the question is, do we stay? And this is a fundamental question where you can have two sides disagree, but still have an agreeable opinion. Do you stay completely shut down until we have a vaccine? And that's a good question. Can you? Someone asked me the other day, well, why isn't the state fining people for not wearing masks? If we have the police going around and giving a fine to every person that doesn't wear the mask, there's going to be some civil unrest. So, look, our hope is that the parks were open 14 days ago. They were mobbed. I drove by them. There was some social distancing, not a lot. Some people a lot of people weren't wearing masks. It wasn't great. Hopefully the weather is killing some of the virus right now. And have not jumped. We have to hope for the same thing as we go along. We've been urging all of the beaches to try to do the best they can to do 6 feet apart. Almost every beach along the Jersey Shore has cut their capacity in half. So I can tell you, like in Asbury Park, they're only allowing 50% capacity. They're marking where people can stand. Is this perfect? No, by no means. Are we going to have problems? Of course we are. But it's either that or stay completely closed. And I think that's all we're trying to figure out how to do.
So,
All right, Farah Hassin might have some questions to
yeah, I have a
our
question
guests.
about the. I have a question about the primary election. So, what about the primary election?
Sure. And I just want to add one more thing. I think everybody knows this already. If people are older, like I have older family members, or they have a compromised health system, they should absolutely stay home. Those are the people most vulnerable, and I think hopefully most people know that. The primary election, the governor moved it from June to July 7th. It is a vote by mail primary if you're a registered Democrat or registered Republican. If you're unaffiliated, you will be able to go to the polling location. Each county has to have at least 50% of their polling locations open. Hopefully by July 7th, we would have flattened this curve even further. And on July 7th, folks will go in. There'll be proper social distancing. Only a certain number of people will be able to. There won't be any machine ballots. They'll all be done by hand. Hopefully people will have hand sanitizer, and they're taking every precaution possible. The reason they can't mail the ballots to independents, otherwise known as unaffiliated, is because they would have to mail 2 ballots for them, and that could cause a lot of confusion, especially if people start sending those back. So right now, if you're a registered Democrat or Republican, you will get it in the mail.
But the vote by mail is not reliable, right? Because in our recent Patterson election, we saw lots of misappropriation.
I'll let Councilman Shaw take that one.
I mean, regarding
All right. Like many things in the world right now, definitely the American primary is facing the coronavirus, because this is such a process. You need to reach people, you need to reach out people for begging votes, right? For achieving your support, definitely. And how American life is experiencing the first time ever in primary is going through harder catastrophe, right? The American primary is experiencing this catastrophe, in many hundred years so far.
Yeah.
If we call since 1917 to 1980, the Spanish flu, which took many lives, which we call it is about 5 to 10 crore people lost their life during that Spanish flu. Since that time, it's 200 years
Yeah.
almost. And in 200 years history, Americans are observing, witnessing such a catastrophic disaster in their life. Isn't it, Senator?
Yeah, look, I would tell you what New York State did, I thought was terrible. The New York Democrats actually canceled their election. No matter what catastrophe happens, what tragedy happens, we saw it in Superstorm Sandy. You have to have your representative democracy take place. You have to have elections take place, no matter what the situation is. So I think this is a good alternative, saying we're going to vote by mail. And if you don't want to vote by mail, you can still go to one of the polling locations on election day, and you can still vote. And both challengers will be there to make sure the signatures match up, to make sure there's only one vote. I joked about the Patterson. It's not a joking matter, but you had a lot of problems in several towns. I think there was a report in Irvington and other places with the U.S. Postal Office leaving ballots in apartment buildings. So a lot of that's got to be cleaned up. And we have to make sure, that core representative democracy, that elections happen. So hopefully they'll happen on July 7th with as minimal problems as possible.
Yes, practice of democracy and institutionalization of democracy must go on in people's life. Being an American, definitely, Hitesh, how are you experiencing?
Wait, you're breaking up. Say it again, please.
Yeah, being an American there in that field, yeah, being a voter, how are you experiencing? What is your experience firsthand as an individual?
My humble ask to our dear senator, why not have an app based? Why even mailing ballots? Let's download something on an iPhone or something that we can just go in, do biometrics. We do our banking, we do our stock trading, we do our e-checking, we do our financial things. It's time for us to America take a lead, and our senators and the councilmen and governor to look into the apps base. Look at India, PayPal, what are they called? PayPal, everyone, you can buy like potatoes and coffee on the apps you're scanning. And I think it's time for us to move to the technology base. Why even bother to receive the mailing? Why not just have an apps download and just put my biometrics finger and just do this? It's technology available.
All right. Yes. Councilman Anand, you want to add some points with Hitesh?
Absolutely, and the senator as well. It's a great question, obviously. I think, just like the senator said, voting is very, very important. I think even vote by mail, right? Every year is an important election, but this year, why is it more important? Obviously, it's a presidential year election, in my opinion. So by allowing to let people vote by mail, giving them two options, right? We're giving them either allowing to vote by mail ballots, or they could also go in a poll if they feel more comfortable, while each of the town, what I understand, will have at least one polling site with the challengers there. So I think that your vote is your voice. You can still be heard and to get out there. So I agree, at least that we have something that's a plan that's put in place. And we'll see how it goes on July 7th. But I think at least there's something there that's already going to be taking place. So now you have not only one option, but that we are giving everyone two options. Which I think is a great idea as well.
Okay.
So
Senator Bean, you are... Yeah.
Okay. I have a question.
Farah,
That is,
please.
a few days back, we saw that the American administration denied to pay WHO any money for the corona vaccine and other stuffs, whereas China gave them a good amount of money. And now, today I saw the news that Trump is agreed to give WHO the money for corona treatment and vaccine, all those stuffs. So how do you find it?
I guess
The question to senators or
Senator?
To you. Mhm.
Okay.
Because you are also working for the health sector.
That question goes to Hitesh Bhatt. Yes, you were working
my
in the health sector.
All right. So here's the thing. Agree or disagree, WHO plays very, very important role around the world. And it's their job to be ahead of the curve. Simple as that. No if or buts about it. They missed this boat. They should know this that this should not have occurred. If I learn something in my healthcare and all this 30 years experience, if I learn something in innovations, I let the manufacturer know, I let the physician know, and immediately stop the assembly line and get it done. WHO failed this thing. Now, question you asked me, Koray, is that can they pay? Now, I'm not sure. I just did a Google while you were speaking. I'm not sure what the true ROI here is, how much United States we're getting back. For example, China's paying only $41 billion, million dollars, I guess, 41, 43. And America, I think we pay almost 500, what is that, $500 million to WHO? So there is accountability. Somebody has to be, and we don't want to politicize WHO. WHO does a wonderful job, no doubt about it. So the UNICEF and other UN agencies. For WHO, I totally agree with the presidents, including governors and the senators. I'm pretty sure senator will agree with me on this. They missed this boat. They should have knowledge share. If technology is available, they could have called the Google, they could have called the Sundar and say, hey, can you create the portal? Let's have access to everybody. And here's the share. Why we are after 6 months, we know the 6 foot distance. When I was in Australia just about a month and a half ago, they were ahead of the curve. They already told me that, Hitesh, when you go to airport, arrive 2 hours early. And you're going to have a 6 foot distance, including your wife. Your wife and you cannot stand next to each other. And so we actually took it when we tweeted at the Buck Foundation. Well, Kimmy was sitting 6 foot away at the car, and we took pictures. So those are the WHO's basic knowledge, responsibility. They miss these things. So just throwing money at the WHO, there's accountability questions, and that's where my humble ask with our senators and governors to go back to the state as well as the federal to say, hey, what do we learn something from this mistakes, and this should not repeat it in the future.
All right. I'd love to go back to the Senate again. He was strongly advocating for reopening the small businesses, yes, to boost up the economy. What's the governor's plan, actually, to boost up the state's economy, sir?
Sure, and I always like to make sure questions answer. I do agree with Hitesh completely. We do have to look at electronic voting eventually. I talked about our antiquated unemployment system. There's a lot of things we're doing antiquated. That's one of them. So I think we have to collectively figure out in the years ahead how we can make voting a better and safer and trustworthy process for everyone. New Jersey is, when I entered the Senate a little more than 2 years ago, we were about $32 billion in deficit. I don't even want to think about what the number is now. New Jersey, as any state of our 50 states, we cannot create money, just like the councilman can't create money locally and the county can't. The federal government is the only entity to create money, and we need some federal help. With the absence of that, there's not a lot to cut. We can reform pension system. We can reform a lot of different things. We've got some proposals on the table right now to save some money, but we're talking about a significant amount. So the governor's proposed borrowing money. The Senate, I know, speaking for myself, is receptive to that. We just want to make sure we're not borrowing more than we need. We want to try to see what we can get from the federal government. The first federal stimulus plan that happened in New Jersey really did not help New Jersey. New Jersey and New York got the same amount of money per capita as Idaho or Oklahoma, which was really disappointing. We should have got a significant amount of more federal dollars because of the number of cases we had. And that directly affects every taxpayer of our over 9 million New Jerseyans here. So we're going to have to do a combination of hoping we get federal money, which I know that Senator Menendez and Senator Booker and Congressman Pascrell and everybody are working very hard on to get resources. So federal money, plus we're going to have to borrow some and bond and pay the debt off the next couple of years to get to a place where we are. And of course, third, we're going to have to look at where we're going to have to cut. I think we're going to have to look at other sources of revenue, probably some sort of additional corporate tax. Corporations got a big tax break under the Trump administration by about 23% to last year. And so a small increase there would still keep them up ahead 19-20%. So there are areas where we need to raise revenue. We need to see where we can cut, and we'll have to borrow as well as hope for as much federal help as we can get.
All right, according to Anthony Fauci, the CDC directives and the forecast, the second wave of coronavirus could be disastrous. It might be stronger, he says so far. So what is the plan for that second phase of that attack? Do you have any information regarding this? How is your plan to address it second time when it will come to Americans' life again, as the Spanish flu got back second time and took many more lives? How are you thinking on this?
Yeah, well, look, it's you always have to learn from your past and learn from your mistakes. There was a lot in this past of the last 60 to 90 days we can learn from. There are mistakes we can learn from, especially our long-term care facilities, the lack of testing, the lack of PPE, as they call it, personal protective equipment for nurses and healthcare workers. So there's no way to know, just like as we learn about this virus, we're learning what it's doing now to children. We learn every day something new about this virus because it's very new. But what we've been told by health experts is that a second wave is likely, and it's likely going to be in the fall. So it's important that we're prepared as far as testing, making sure that we have a plan. So we're working with our schools if we need to shut down so they don't have 3 days notice this time, that there is an online learning plan that we can put together. We can figure out a business plan. Maybe that might involve some companies only sending half of their employees or younger employees. We got to figure all that out, make sure it's done legally and health consciously, and making sure that we have enough protective equipment and testing supplies when this happens. If we're in a position where we can test every American regularly, whether that's daily, every other day, as much as possible, and get the best testing possible, we're at a significant advantage.
Okay. According to World Food Program, WFP, more than 80 million people may fall in famine if the lockdown continues. That's terrific information. How prepared we are, how the world will respond to that forecast given by WFP, because hunger is everywhere, and still some countries in Asia, Europe, and Africa is going through this brutal experience. Do you have any comment on that, Senator Bin?
Sure. On hunger in general?
Yes. According to World Food Program, plus 80 million people will face famine.
Yeah.
Severe starvation. They have to come across, as right now Asia, Africa, and some parts of many parts of our continent of the globe, they're coming across this experience by this time.
This is a moral responsibility I believe, of government. It's a possible fundamental disagreement among some, but it's a moral obligation that your residents have the basic needs and basic protection. No child, 2 children in 2 different zip codes should make sure they have the same opportunities when it comes to schooling, police protection, and food insecurity. So I think, one of the challenges we've had in New Jersey, where our poverty rate has definitely gone up in many of our urban communities, is identifying those families. And that's what we're really trying to do. We've put monies in for our food banks, which are doing an incredible job up in the councilman's area, all the way down to South Jersey and everywhere in between. Those food banks are working hard, but we need to get out to those family members to make sure they have food, make sure they have opportunities. And it's not just the food insecurity. It's working with that family on a long-term plan to help them get out of that situation so the situation doesn't fester.
All right. Now, I'll go to Anand again. According to International Labour Organization, ILO, it says 160 crore people might be jobless. Anand, as a councilman and a politician, how you look the threat which is coming globally and, of course, in America's life?
And that's another great question. So people that are jobless right now, I've been getting calls on this as well. What do we do? Is there anything down there? Because obviously we're stuck in the house in quarantine, right? So help is on the way. Hope is on the way. What happened a couple of days ago? I'm not sure if the senator touched on this or not. I'm sure he will before the interview is over or the conference, is that the $3 trillion package that has been approved, to my understanding, unemployment that has been extended already. Instead of getting, I believe, 6 months unemployment extension, it might be going up to 9 months or 12 months. I don't have the exact data in front of me. So at least the cash flow for families to put the food on the table and the basic necessities are required on the daily needs that we need, it is there. And I think slowly but surely, again, when the faucet we're turning on slowly and we turn on a little bit more daily, right, or weekly as we're going on, I think then our daily lives could continue, but it will be a slow progress that's going on there. So even I think health is the most important thing right now. Our safety and our health is a number one priority. Then I think job will come number two. Because without our good health and our safety, how can we even go to work, right? There's a chance that we might even catch it there if we don't follow the social distance guidelines. We don't have the mask on. We don't have the gloves on. So it's very important that we move in a very slow direction like we've been doing. And this will be the biggest test coming again, will be on Memorial Day weekend when the beaches open up, when the shores open up. How do we follow those guidelines? Are we going to follow those guidelines, adhere it to make sure? If that goes, maybe I'm sure there's going to be a plan put in place. Slowly but surely, non-essential businesses will reopen. Like the senator said initially, that they started allowing curbside pickup going on. So in order to do curbside pickup, we need manpower, right? So the jobs need to go back in place. But again, your health should be our number one priority. Safety should be our number one priority, and then the job. Unemployment's on the way, extensions on the way, at least to go through this pandemic and these times.
Okay. I need to read some messages, some questions, definitely aiming the senator. How urban enterprise will help the local business in city of Patterson? Thank you. Question to Benata Singopal. And of course, another one question. When will business open in Patterson? Mohammed Hanif, the same question to you, Senator.
Yeah, I mean, look, that's hard to tell. I think that the governor and the state are starting to put out plans. I know they're looking at outdoor dining. I know they're looking at indoor capacity. So I don't know when the timeline is. That's ultimately up to the governor. But I know that they're entertaining to try to figure out, if you have a little store, how many people can be in, if you need to wear a mask, whether you can do 6 feet in. I certainly need a haircut. I know a lot of other people do. How barbers are going to operate, how a lot of other professions are going to operate. A lot of businesses like towns, in my town in Long Branch, they're actually taking outdoor space. So they're taking vacant parking lots and vacant streets, side streets that they're going to be closing down to really expand retail outdoors for clothing stores as well as restaurants. So because the virus spreads a little less aggressive outdoors, and you can kind of spread out 6 feet apart. So I think this, I'm sure the leaders in Patterson, Mayor Saya, who's really done a good job throughout this pandemic. I know that they're going to be proactive and take the steps to try to see how they can make sure people stay safe and at the same time get the economy open.
Okay, I'd love to read another question from Elizabeth Ortiz. Can we discuss the future of reopening our schools? What impact does this have on the education of our children, and what plans are being set in place for a standard curricula in case we have to transition to online instruction in September?
Senator.
I would just say I've spoken directly to the Commissioner of Education, New Jersey, Commissioner Repollet, about this, and I know they're planning on online instruction to be ready. Not to say that it's going to be online instruction in September, but it's possibly open and then a wave happens in November or next February, whenever. And if we still aren't at a place of a vaccination, we might have to take those precautions. So I know they're doing everything they can. And to really make sure is that, look, as a state and a country, all included, we made some mistakes. We knew this virus was here early in January. We knew that there were, we apparently on the East Coast, according to health reports, got hit with a more European version of the virus, a strain of it, whereas on the West Coast, they got hit with an Asian Chinese version of the virus. So there were different versions of this virus. We might have acted, in my opinion, we did act a little too late on some of this stuff. we need to learn from those mistakes and make sure that going into the fall that we are prepared, especially in the area of education.
All right. Perhaps this would be the third question to you, Anastasia. Then I'll get back to Hitesh about the coronavirus situation. Senator, this is the third question to you before I go to Hitesh. Do you have a different guidelines than governor, and why?
I have
A
a lot.
question from Ambar Haq. Do you have a different guidelines than governor? If so, then why?
I have a lot of different ideas. I have some similar ideas, but ultimately it's the governor of the state of New Jersey. We will push, we will give advice, we will give recommendations. He takes some, he rejects others, but ultimately he will make that call.
All right. I'm now going to Hitesh Bhatt, as you are working with health and education, definitely. I'm asking another question from other continents. You know, as per WHO, the organization has given us a forecast that there are about 4 crore people in Africa may be infected by the coronavirus, and it will remain a few years ahead there. It will be prevailing. It's not going very shortly. And in the year 2021, coronavirus can kill more than 1 lakh people in Africa.
Wow.
What are the points you have to say? Yeah, in Africa, it will continue to stay on more in a few years and can kill more than 1 lakh people there in that continent in Africa.
Right. And other countries too, in North America,
Yeah.
Central America. Don't forget Central America. I'm very humble and honored to be part of the Goodwill Ambassador to Honduras. And Rotan completely shut it down, and they have a zero infections, any patients, because they completely locked it down. Look at Australia. You're in Australia. Australia locked down while we were there. Nobody allowed to come in. As soon as you land, you just go straight to the hotels for 14 days quarantine, and you're not allowed to even go anywhere. But again, what I wanted to go back to the previous question, what Councilman answer and our Senator answer. So we are the most advanced, blessed technology country in the world. We own more IP, intellectual property rights, development in the world. Why we have to be third world country when it comes to healthcare, when it comes to PPE, when it comes to ventilator, when it comes to technology? I mean, just think about this. I just cannot believe this as a technologist, as a innovators, as a healthcare providers. I just cannot believe this, that we are in this mess. We are the leader of the world, and we need to provide third world country in Central Americas and even in Asia and Africa. So, hey, here what we learned, and we need to take over one step above WHO. Or maybe we need to be in the driving seat to the WHO or UNICEF or CMS or like Wasima Verma's doing a job or HHS, because we cannot have a ping pong game with what's going on right now. And again, technology, what Anand says and then our senator says, technology is really doing it. Every other country's doing it. China's even doing it. Look at China. If you look at China, if you wanted to go outside, you have a barcode scans on your apps. And a WeChat, they don't do WhatsApp, so they do on WeChat. Once that code tells you, you have to scan them. And the system tells you that you're allowed to go inside or you're not allowed to go in. I mean, why we are not there yet? The school, using the barcoding system, they track where is the real time, the location, geolocation, that it tells me that I just met with the other person, and that person just infected by COVID, and not to meet with them or stay with them. COVID doesn't mean that the person's a bad people. It's just the infection. It's just the precautions, and those are the things. So going back to my point is that we have to use technology. Google, Apple has a partner with them. CMS has to take the lead on this, and it just drives me nuts. It makes me so angry. Here, all this innovation I have in my office here that I don't even have storage in room here, and we cannot use to consolidate and take advantage of it. So Dr. Huck at home can decide before when he goes to the hospital and say, okay, I'm just not going to go to entrance A, but I'm going to go to entrance B, because that's what the safest way to get to what I wanted to do. And those are the things that it drives me nuts. And I hope that we all come together. Doesn't matter you're Republican, Democrat, or you like Google or Apple or Android or iOS. I'm done with this. It's time for us to take a lead. And I hope that we move forward on this, because this thing's not over yet until we find a vaccine. And the round 2 is coming. It's just a matter of time.
All right, Anand, you are observing the people's life there in New Jersey. Definitely, you have quite a great experience of, witnessing the life of the marginalized people, the life of the lower income people, and of course, the people who live hand to mouth. So, what is the exact situation there in the field?
Absolutely. So and thank you. Another great question. So basically in Prospect Park, we've been very active, and I know some of the people have joined in from Bangladesh or India that's watching live. Prospect Park is in Passaic County, New Jersey. We've been very mindful of the financial strength and the burden that this virus has caused. Under the leadership of our Mayor Krula and our council, we continue to find ways to assist the community by keeping our budget in mind. We have been blessed to receive some grants, such as the grant that we received from Massachusetts-based Sports and the Green Acres grant. The grant will help the borough keep its budget flat in the Parks and Recreation Department. Also, the most current grant that we received, which has definitely been a great help and use to our Prospect Park Volunteer Fire Department, thanks to our Firehouse Sub Public Safety Foundation. Prospect Park currently, our own very Mayor Krula, has been doing a great job in keeping us updated daily through his Facebook Live videos at 9 p.m. every day, letting us know what are the numbers throughout our county and throughout our state and throughout our town as well. Our borough administrator, Intishan Chowdhury, and our BA assistant, they also been around the clock working extremely hard, working and beyond to ensure that all of our residents are kept informed through our Facebook page, website, and through our new emergency code red notification system. And then we will also continue. Go ahead. We will also continue to adhere to the governor's recommendations and awaiting direction on a daily basis for our future of reopening plans. So we've been very active in Prospect Park. Just today, thanks to Synoc Poultry, as some of you may know, they're a big meat distributor. They donated today 200 meals, 200 meat packages, and we had a line of people social distancing today at 3 p.m. and we were able to deliver 200 meat thanks to the donor, Synoc. So these are the things on a daily basis. Now we might be getting PPE, masks that we could donate out, like Hitesh was saying earlier, gloves. So we are doing everything that we can. We're also the middleman, putting our titles aside for a minute. Any resident that calls, like the senator said, I'm having issues with our unemployment. So our administration, our BA and our administration, they will take the call and if we have to call this, if they have to call the state, they will guide them to the state until that problem is resolved. So the resident is ensured in Prospect Park, there is hope on the way, and there's help on the way, and there's no fear. And this is what we're doing on a daily basis, 24/7, around the clock. What else are we doing in Prospect Park for the little kids? Every day we have birthdays in Prospect Park. We're bringing out between 5 to 6 p.m. You sign up the day before or day of on a Google Sheet, and we send out the fire trucks with our fire chief. The police officers will go out there, put the sirens on, sing them happy birthday, stay in front of the house for about 45, 60 seconds, sing them happy birthday to make sure that child is knowing that even though COVID-19 is going on, the pandemic is going on, but your birthday is not forgotten about. And our mayor has done daily videos.
For the mental health of the children.
I'm sorry?
This is good for the mental health of the children.
The mental health of the children. I'm sorry, I didn't understand the question.
Yeah, I mean, what you have been doing for celebrating the birthday of the children like this. So this is good for the children's mental health, I think.
Absolutely, absolutely. Because it also gives them an opportunity to come outside the house. Hey, it's my special day. It's my birthday. And as some of you may know, birthdays mean a lot to me. They actually touch my heart. Even before the COVID-19 in my town, if it's someone's birthday, and if it comes up on my notification, I try to bring them a fresh birthday cake, as some of you may have already got. And but right now, obviously, because of COVID-19, I can't get it. So at least we have this system in place. So every day, we're doing as much as we can, And no one's perfect, right? We all gonna make mistakes. We have not experienced this pandemic. Why do you think the governor's coming on daily? Why do you think the senator's posting on daily? Why do you think the senator's fighting in Trenton for us? He hasn't even mentioned about the $100 million package that him and Assemblyman Raj McCurry has got done. That they have pushed for us for small businesses. What they have done, the $3 trillion package. So there's help on the way. There's hope on this way, and together we will achieve more. We need to stay positive. We need to work together and not give up. Like Hita said, we should not be a third world country. We have the IT, we have the technology, we have the smartest people in our country. We need to get through this slowly but surely. I feel hope. And
how many COVID testing sites do you have in Prospect Park, Councilman?
I'm sorry.
How many COVID testing sites do you have in Prospect Park? Do you have any?
Yeah, so absolutely. That's a great question. Actually, as of today, we have 279 tested positive in Prospect Park as of today, and we have so far 2 deaths in Prospect Park. And let me share. Also, if you guys allow me to, I might even have the county numbers as well as of today for Passaic County. So as of Passaic County today, we have 15,031 positive test results, and we have 831 deaths. And that's a huge number. Every life that we lose, it's not, I mean, it takes a toll on all of us. I mean, 15,000.
Is there any number of deaths in Prospect Park?
Yes, we do. We do have 2 confirmed thus far, unfortunately.
Oh, that's
All right. I have a couple of political questions. It's regarding international politics. Senator Venugopal, you have witnessed so far in January, there was a business agreement between Beijing and Washington. In a business network interview, President Trump has said the agreement is not seen visible. It's not going to get back to its own force because the ink is right now drying. Do you have any comment on that? And President Trump is reluctant to talk to Xi Jinping even. So as a politician, what should be your view? And before you start answering to the question, I would like to read another question from our audience. The first phase of SBA loan already took by small business, and right now the website are unavailable to apply. Would you please advise us what's the update of SBA loan time frame? Question is to Senator Venugopal. Before you answer this question, what I asked you, do you see any progress of the business agreement took place in January between President Trump and Xi Jinping?
So I'm going to do my best to answer 2 federal questions. You ask me any state questions for New Jersey, I'll knock them out of the park. The federal ones are a little harder. I looked at the articles on the agreement. Look, I think everything with the president, it comes down to his temperament. We see it at, I'm fascinated to watch the relationship between our governor, Phil Murphy, who actually has much different than our prior governor, Chris Christie, who was, much more rambunctious and on the beach and doing all this thing, where Murphy is much more mild-mannered. There was an article that came out yesterday that showed how much him and Trump actually get along, because he basically credits him and doesn't criticize him when he's wrong, which is probably the best route to take with Trump. It's really a lot with a lot of these foreign deals. So when I look at that, the one that you're describing, I hope that the temperament from the president and his people and temperament will get us a far way there. But unfortunately, I don't mean to dodge the question. I've read as much about it as you have. As it relates to the SBA on the PPP, for your viewers, the PPP is a federal program for businesses to basically keep their payroll on for an additional 2.5 months. The first batch of the PPP ran out, and then Congress voted about 14 days ago for another batch of a few $1 billion into the PPP. Tens of thousands of New Jersey businesses have taken advantage of it. I think your viewer's specific question, and I'm sorry, I just had it right here, is first phase of the SBA loan already took by smallest right now. The website is unavailable to apply. Would you please advise us what of the SBA loan time? I have not heard that the website is unavailable to apply. You need to apply through a bank. Your bank is your best part to apply. Most community banks and other banks, with the exception of some of the big ones like Wells Fargo, are still taking applications. But if you want to reach out to my office, sendgopal@njleg.org. Again, that's sendgopal@njleg.org. I'm happy to connect you with your member of Congress. If you're in the Passaic County area, it's probably Congressman Pascrell. It could also be Congresswoman Sherrill, but I'm happy to connect you with your congressperson. Of course, you have Councilman Shaw here, who I'm sure would be more than happy to connect you and try to get you those federal answers on the SBA loan time.
All right. I'd love to read one more question before we end of the show. This question is to Anand. You are a councilman in our city of Prospect Park, always helping and serving our residents. As a wonderful councilman, what's your idea or advice to other city councillors, especially in Paterson and Wayne?
Great question. So basically, like I said, we've been taking it not lightly in Prospect Park. And I would never badmouth anybody. I think everyone's trying to do the best they can in some sort of fashion, the way they can. Basically, like I always said, even before the COVID-19, right? What is my slogan? Team, right? What does team stand for? Together, everyone achieves more. Again, together, everyone achieves more. So by working together, by giving help out there, giving donations out there, giving out meals, anything at this point, it's always a help, right? And that's my advice to a suggestion to everyone, that we have to put our politics to the side, even if we're a Democrat, Republican, like the senator said in the beginning. Doesn't matter who we are, but we're just regular human beings, just like our residents, and we need to come together and continue working together to make sure our residents and our families and our health stays top number one priority. Our safety is the number one priority, and we could keep moving forward, I think. And whatever, it shouldn't be any grudges, right? One thing I always say is that there should be no grudges held at all, right? Because life is short, as you guys are seeing every minute of the clock. What's happening? Hitesh was saying earlier, we have so many deaths throughout the country. I mean, why? So life is short. We only live once. And this is the time that we need to come together and put our differences to the side, work together. And another example, for example, Senator Vingopal just said to one of the audience that, hey, you know what? I'll be more than happy to connect you with your congressperson. He's all the way from Monmouth County. But again, he went above and beyond right there by example, showing, hey, you know what? Here's my email address. Reach out to me, and I will make sure I connect you to the right person so we can try to get your loan applied. So, and this is just an example. Again, by working together, I think that we could definitely move forward. Not only Prospect Park, Passaic County, and throughout the state of New Jersey.
All right. This question is to Hitesh Bhatt. Elizabeth Ortiz, she has a question to Hitesh. She says, I have a question for Mr. Hitesh Bhatt. What are your thoughts on our current testing abilities, and what recommendations would have to improve our current testing capacity? Hitesh.
Wait, say it again, please. What current?
Yeah, Elizabeth Ortiz, she has a question. She says, you can see on screen, yeah, you're watching screen. I have a question for Mr. Hitesh Bhatt. What are your thoughts on our current testing abilities, and what recommendations would have to improve our current testing capacity?
So it's a wonderful question, Elizabeth. And
Can
you hear me?
Yeah.
Okay. So why not? Everyone has a phone in America, right? We all have a phone. Even 4-year-old kid has a phone in their school. Why not put the apps on the phone and say, today, Passaic County, it's only 40 people show up, North Heldon, Prospect Park, Wayne, or anyone, William Patterson University, there's 4 slots available. When we launch apps at the university hospitals at Hackensack, or we were working on POC, proof of concept, if you go to Mayo Clinics, you go to HFS, or you go to Rush, the apps tell you what floor to go and which spot you can park your car. So we can do that for the outpatient services. Why not we not doing for this testing? So Elizabeth might have family members. I have my family members, and the apps will tell me on iOS or Android and say, okay, Hitesh, you are available. You have not tested. Today is a slot open 2 to 2:30 at the William Patterson. Please go there and get it done. We want to know that you are negative. That's number one. Second thing is, we just learned from India. I just got a briefing from India that they received the first Chinese version the testing kits, it was almost like 90% false positive. So they just canceled their procurement contracts. And we learned from White House briefing a couple of days ago, the current testing with the COVID was almost like, 15% positive, negative. So we need to work on it. We need to have everybody, CDC and CMS, they really need to get their act together. Because we need it now doesn't mean that just get it done. I can get tests right now, but if it's a false positive, that doesn't mean anything to you, me, or my neighbors, or my families, or my loved ones, right? So that's what they need to work on. So the most important thing is accuracy, accessibility, and availability. And those are the things are most important for American people at this point.
All right. I'd like to conclude the show. Can you be honorable discuss, including Senator Veen, definitely. Farah, do you have any question? And I would expect to have the optimism during this crisis from the senator. After having your question, I'll go to the senator. Farah.
Yes, we want to hear from our senator something.
No, thank you for having me on. God bless each and every one of you. To your viewers and visitors, stay strong, and we must all lift each other up. I empathize, as I know everybody else here does, with everyone going through a difficult situation. This is not ideal for anyone, but together, I know we're going to be stronger together as we get out of this. And it's important now more than ever to look after a neighbor, family, friends, loved ones who may be going through a difficult time, especially as you talk about that mental health capacity. It's important that we work together to lift everybody up. So God bless all of you. Thank you.
Thank you, Senator.
All right. Yes, you wanna add some more points, Farah? You're trying to add some points?
No, thank you, Senator.
All right. I hope it's a good wrap up and good optimism from the Senator Venugopal. And of course, I thank you everybody for joining this show, and particularly thanking Senator Venugopal for your gracious time and productive discussion here. And of course, thank Anand Shah, Councilman, and of course, Hitesh Bhatt. He is the president and CTO of Bhatt Foundation, who is tremendously working for the people's betterment in health and education service. I thank you, all of you gentlemen, for joining us and for making this time very productive for Channel 52 family. Hope to see you sometime with some productive session again. I thank you, everyone. Have a very, very good night.
Thank you. Please, everyone.
Good night.
Thank you. Good night.
Take care.
Thank
Good
you.
night.
Thanks,
Thank
everyone.
you.